Okay, so dried blood spot testing. What do we test for? So when we're thinking about what we're testing for, we've got two concepts here. We've got antibodies, so those are proteins that our body makes to fight infection. They're kind of like little flags, antibodies, and they're designed to stick to something that your body doesn't expect to be there, right? And they label it with a little flag and the immune system comes and takes it away. What we detect in the dry blood spot are HCV antibodies. So that says that your body's had Hep C in it and your body's recognised that it's there and it's produced these antibodies. For hepatitis B, we detect the surface antigen. If you remember when we were doing the hepatitis B bit, we talked about the fact that this virus makes thousands of times too much of the surface antigen protein. So an antigen, as opposed to an antibody, is a protein that the virus makes. So this antigen is something the virus makes, so if that antigen is there, it means the virus is there. Okay? So if you've got surface antigen, you've got virus. If you've got HCV antibody, then you've been exposed to that virus. With HIV, we test for the antibodies and we test for an antigen called core protein, or P24. So for HIV, we're testing for both the antibodies and for the virus directly. So after that part of the test, you would know whether or not you had Hep B or HIV, and you'd know whether you'd been exposed to hepatitis C. To confirm any of these results, they would then also do a test called PCR, polymerase chain reaction, and that tests for whether the virus's DNA or RNA is there, its genetic material. Okay, so this is what the kit looks like. This is what's in the kits that come from Manchester at least. Okay, so you end up with a card with a flip panel. Inside the flip panel are 5 circles. The aim of the game is to fill those with blood, and somewhere to write a patient identifier information. So that might be name and date of birth, but it needs to be enough information to identify that patient, and also to give them some idea as to where the results are going to go back to. Mr. Smith doesn't really cut it, and trust me, having worked in diagnostic labs, that sort of thing happens. Okay, you've got 2 lancets. We'll have a look at them in a minute. So essentially, these are spring-loaded pins that very quickly fire a piece of metal into the side of your finger, and it allows the blood to come out. There is a sachet of silica gel. That's to help dry the cards down. It says do not eat. I've never at any point been tempted to eat it. Now, before you poke a hole in somebody, it's a good idea to clear away any germs, anything nasty, and we use the alcohol pads to do that. And obviously there are some people that bleed and continue to bleed afterwards, and we've got a little plaster to cover up the hole. You should wear disposable gloves. I'm old enough to remember latex gloves, and you'd get people who had skin reactions to those. Most of you would only have access to the brightly coloured gloves, the nitrile gloves, and I'd recommend them not least because they're the best barrier against viruses. You ask your patients to wash their hands so that they're clean, preferably, and if you've got a tap with warm water, even better. So when we get cold, our circulation only runs around the middle and it doesn't get to our fingers and toes. In fact, most of the women I've ever dated, I think their circulation stopped at the elbows and the knees. If you can get your patients to warm their hands up, if you can have a warm room, this room is lovely and warm. If you can have a nice warm room, you will get more blood from the patient. Talking to a guy, the first time he started doing dry blood spot tests, he used to prick people on the end of their finger. Our nerves are not evenly distributed. If you prick somebody on the end of the finger, it will hurt. If you prick somebody on the side of the finger, it's unlikely to hurt. Okay? So this is the area of the finger that you're aiming for. Okay? And what I want you to do, before you do your dry blood spot test, is to think about what orientation their finger is going to be in. Right? Because the temptation is to grab somebody's finger and prick in the most convenient place possible, which is often the top of the finger, and then you're trying to put the dry blood spot with their arm halfway up their back, twisted round. So think through what orientation it's going to go in. You might go there, and then it's easier to bleed them. So think about the orientation of the finger. You're going to clean the site with alcohol. Patients will know when it's dried, because when you rub the alcohol on, it's cold, and when it stops being cold, it's dried. You open these lancets by twisting the top. They're spring-loaded, so there's no sharp bit on the end. There's just a white cuff. And what you do is you press the body of the lancet against the finger until you hear a click. When you hear the click, that's the metal bit going and back out again, and that's made that little hole. You throw the lancet into the sharps bin, and you spot the blood onto the card. Try not to touch the card, because the card isn't sterile and you've got a hole in somebody's finger. But equally, there's no extra marks for hitting the spot from 6 feet away. So remember that blood flows downhill. So if you can have it pointing slightly downhill, you can massage the finger to make sure you get blood out, but the aim is to fill the circles. If you don't fill the circles, what will happen is in the lab they'll say, well, your sample's negative, but we're not sure there was enough sample, so we can't be confident that that person doesn't have the virus. And then you have to do it again, and that patient might not still be with you, so it's a missed opportunity. So try and fill the cards. You will get some people who will literally fill all of the card and bleed everywhere, and you'll get some people and it's like trying to get blood out of a stone. The warmer it is, the easier it is. So the instructions on the kit say that you leave the cards to dry for 30 minutes. All three of these viruses are much more stable if they're dry. I mentioned earlier that I'd tested serum from mums who'd had the anti-D immunoglobulin when they were pregnant. We actually had a freeze-dried serum sample. Now that accident happened in the 1970s, and I was testing them in the 1990s, and I could detect virus after 20 years in that dried sample. Now I'm not suggesting that you take 20 years before you hand the cards in, but it's pretty stable under those conditions as long as it's dry. If it's not dry, then the blood will get stuck on things and cross-contaminate, and it's not quite as stable. To ensure that you're taking the last of the liquid out, that's what the silica gel's for. So that the cards go back into the bag, the silica gel goes in, it's sealed up. I haven't got any with me today, but also with your kits you should get an addressed envelope. So all the paperwork and the cards and in the plastic sealed bag would go into the envelope, and then they'd all go off. Right, so exactly what happens to your dry blood spot. So you've filled your card and you've sent it off to the path lab. What they do is they remove the strip of dots. With the ones from Manchester there are 5 dots. They take the first 4 and they punch where the circles are, and they make a little stack, and they put them into a liquid. It's called elution. They elute the virus back out again into the liquid, and then they take that liquid, and then that's the liquid that they test. Okay? They stick them on this machine here. It's called an Architect, and that does all of the tests that I said in that list. Okay? Anything comes up positive on the Architect, they take the 5th spot, they extract DNA and RNA from that spot, and then they do a PCR test on it. So that will confirm, or with the Hep C, it will tell you whether there's virus there as well as just antibody. And with the others, it's just a way of confirming. So at the end of the dry blood spot testing, you've got a confirmed result for any of those 3 viruses. Now, at that point, you may need further testing. You might take venous blood to get a viral load taken so that they can initiate treatment. You might need to take venous blood genotype, but at least at that point the patient will know whether or not they've got a viral infection.